Hi guys, welcome to Healthy Living with Nurse Mo, the channel where health finally makes sense. Welcome to series 3 of Healthy Living with Nurse Mo. This week we're going to be talking about hypertension, which is also called high blood pressure, the silent killer. Why is it called the silent killer? Did you know that millions of people are living with high blood pressure and don't even know it? And that's why hypertension is called the silent killer. It can affect the heart, the brain, and kidneys over the years without any symptoms. In this video, we're going to be looking at high blood pressure and what's happening, what's going on in our body again. We're going to be talking about why it's happening, the risk factors, complications, and also the 7 warning signs. Okay, the 7 warning signs. You don't want to miss this. If you see any of these warning signs, it's very important that you reach out to your doctor. And we're going to be talking about that and how we can control it to protect our body and our health. First, let's understand what hypertension is all about. Okay. As the heart pumps blood through the body, there's a force that comes with that blood that's pumping through the body. And that's what hypertension is all about. That's the blood pressure. That blood pressure is the force that it takes for the blood, for the heart to pump blood through the body. Okay. And normally we should have our blood pressure at 120 over 80. That is the normal range for the blood pressure. However, if the blood pressures consistently stay high, it means that your heart is working overtime. Your heart is working overtime to pump. Your heart is stressed out, okay? It's stressing, and your blood vessels are under consistent stress, okay? So your heart is working overtime to pump this blood because the pressure is really high, okay? So we have to be mindful of that. Over time, with consistent high blood pressure, it damages the heart, it damages the brain, the kidney, it can lead to a lot of complications. If your blood pressure stays consistent at 130 over 80 or even higher, it is considered hypertension, and it's very important that you see your doctor. Now, let's get into why high blood pressure is very dangerous. High blood pressure is dangerous because over time, a person can have high blood pressure and not know it, like I said in the beginning. And what happens is it begins to damage our system, our organs over the years. And uncontrolled high blood pressure can lead to serious health conditions. Okay, the person can have heart diseases or stroke. They can also have stroke. Okay, it can lead to stroke. A lot of times I've seen that patients who come in with stroke are under stress. And what happens when you're under stress? Your blood pressure goes up, right? So we want to be mindful. We want to be able to control our stress levels. We want to be able to control the blood pressure so it doesn't lead to stroke and other heart diseases. It can also cause brain damage. Again, it can cause brain damage because what's happening is the pressure is high, the person can have stroke, and then stroke can cause brain damage. Okay, and it also causes kidney damage as well. Kidney damage, vision problems, heart attack. Okay, a person can also have heart attack. So over time, the constant pressure can weaken and narrow our blood vessels and arteries, and this will cause a reduced flow of blood. Now, let's look into the risk factors. What are the factors that put me and you at risk? Stress is a very, very huge factor that puts a person at risk of having hypertension, high blood pressure. When your body is under stress, your heart has to pump more. Your heart has to do more work for blood to flow. So reducing your stress is very important. High salt intake. This is another big one. If you see any high blood pressure patient or hypertension patients, there's always the advice is to always reduce their salt intake or look for salt alternatives. We have a lot of salt alternatives out there. You can always change it. You can always use other type of ingredients to make your food. Salt does not have to be part of the ingredients to make your food, or you look for salt alternatives. Okay, a lack of physical activity. Now, moderate physical activity is needed. 30 minutes, like I said before, and I'll keep saying it, 30 minutes of exercise 5 days a week, meaning 150 minutes of exercise in a week, would do you a whole lot of good, and it will help to reduce your blood pressure. Smoking is another one. Now, being obese or overweight is another one. Again, you have to be physically active. You have to try to lose weight. Gaining weight, being obese, being overweight is not helpful to your health at all. So if you know that you're on that part, start working out, start eating right, start doing what you need to do. Excessive alcohol consumption can increase your blood pressure. Avoid caffeine, avoid alcohol. I always say avoid caffeine, avoid alcohol. We have decaf options, we have other alternatives, but avoid alcohol because excessive alcohol consumption can cause hypertension. It can affect liver, kidney, name it. And family history of hypertension, that is something that we can change. We can change where we come from, who we come from, okay? But we can change the other things like stress, like your lifestyle, your diet. You can, if you do know that you have a family history of hypertension, you can manage your lifestyle so that it doesn't, you don't end up with hypertension in the near future. Now age, like I always say, is a constant factor that plays a big role in our health. I've seen young people who end up with stroke. Again, it could be family history, it could be their lifestyle that got them to that point. But as we get older, it increases our risk of all these health conditions. And so age plays a big factor in hypertension. Our blood vessels begin to lose flexibility over time. So age plays a big factor in hypertension. Three things that people get wrong, okay, when it comes to high blood pressure. And we're going to be talking about those three things that people get wrong. And the first one is, I'd feel it if my blood pressure is high. No, you would not feel it, and no, you would not know. All right. However, the symptoms can come in, and it's very important that you know those symptoms. If it now becomes a constant symptom, you need to see your doctor. Again, the symptoms sit in your body and can cause damage over the years. Medications mean I failed. Medications, you taking medication does not mean you have failed. It just means that you're staying on top of your health. It means that you're taking charge of your health. Okay. Another way to take charge of your health, again, I'm always going to go back to it, is by changing your lifestyle, is by choosing the right lifestyle, diet, exercising, avoiding smoking, avoiding alcohol. All of those things are very important. The three things that patients usually get wrong. I'd feel if my blood pressure was high. No. Symptoms stay in your body and you would not know. The second one, medications mean I have failed. No, medication does not mean that you have failed. Medication simply means that you're taking charge of your health. Okay. And now the third one is, once my blood pressure is normal, I can stop taking my meds. No, you can't stop taking your meds, and no, you shouldn't stop taking your meds. If your blood pressure is within the normal range, you need to see your doctor. You need to see your provider, and they will have a conversation with you. They will go through your medical history with you, and then they can make decisions with you based off of that. Now, let's talk about the 7 signs that your blood pressure may be high. And most people miss number 3. Number 1, frequent headaches. Persistent or severe headaches, especially in the morning, can often mean that your blood pressure is high. Okay, it can often mean that your blood pressure is high. So, when you have persistent headache, especially in the morning, and it's very severe, if you have a way to check your blood pressure, please do check it. And if you see that your blood pressure is high, you want to see a doctor. Okay. Number 2, shortness of breath. Okay. Shortness of breath. High blood pressure can put extra stress on your heart and lungs. Like I said, the heart is doing so much work, leading to difficulty breathing. And to let you know that all of our organs are linked in a way. When the heart is affected, the lungs can begin to get affected, the liver, the kidney, they're all working together to make sure that our body is doing the right thing, right? So when your blood pressure is elevated, it's affecting the heart. Your heart is pumping so much blood, the lungs can't keep up with it. And so what? It's difficult breathing. Okay. So when you're having shortness of breath, even when you're resting or when you're doing any activity, you want to be mindful of that. Okay. And if it's constant and it's consistent, you want to see your doctor. Number 3 that most people miss, is often missed, and it's nosebleed. Nosebleeds. People think that nose bleeding is just, oh, maybe something, maybe I hit my nose. Maybe it's not just that. It can also mean that your blood pressure is high. Okay. Occasional nosebleed can happen for many reasons. Repeated or unexplained nose bleeding. If you can't explain it, if it's repeated, if it's constant, it can be associated with high blood pressure. Make sure that if you have nosebleeds and it's unexplained, it's consistent, it's happening over and over, it could just mean that your blood pressure is elevated. Okay, so you want to see your doctor for that. Number four, blood or double vision. Blurred or double vision can often mean that your blood pressure is high. Again, you want to see your doctor for that. Number five is chest pain. Chest pain can be can be as a result of elevated blood pressure. Okay, again, remember that your heart is working over time. There's a lot of workload on your heart. Okay, so when there's a lot of workload on your heart, it's contributing to that chest discomfort, pressure in your heart, and you want to make sure that you see your doctor to address this situation. It could be a sharp pain, it could be a shooting pain, it could be a stabbing pain, it could just be pressure in your heart. You want in your chest, you want to make sure that you see your doctor. Number six is dizziness or lightheadedness. Dizziness or lightheadedness can mean that your blood pressure is high. If you're experiencing episodes of dizziness, okay, especially if your blood pressure is up, it's going up and down, it can cause dizziness, it can make you feel lightheadedness. As soon as you feel that and it's consistent, constant, you can't explain it, you make sure that you check your blood pressure and see your doctor. Number seven, irregular heart palpitation. Irregular, like your heart feels like it's beating so fast. Okay, it's racing, it's pounding. Like irregular heart palpitations can often mean that your blood pressure is high. Okay, it means that your body is under stress, your heart is under stress. Okay, if you're feeling that racing sound, that pounding sound, and it's like skipping, like your heart is skipping, that is called heart palpitations. Okay, and it's irregular. Okay, so you want to see your doctor. Now those are the seven signs that your blood pressure may be high. And like I said, number three is often missed, nosebleed. We want to make sure that if you have any unexplained nosebleed and it's consistent, you want to see your doctor, because we want to be able to catch this high blood pressure before it becomes something worse and that can damage our organs. So let's look into the things that we can do to control or to prevent it or to control it. Okay. The first one is to reduce salt intake. Again, too much sodium can cause your blood pressure to go high, right? It can raise your blood pressure. Too much sodium can raise your blood pressure. So look for alternative options, alternative sodium options. You can also use those. Okay. Exercise regularly. We need to exercise regularly. 30 minutes of exercise 5 days a week will do you a whole lot of good. Okay, it will help to lower your blood pressure. Number three, maintain a healthy weight. Maintaining healthy weight. Maintaining healthy weight is very important and will make a big difference lowering your blood pressure and even preventing high blood pressure. Eating a heart healthy diet. Half the time I see that when patients come in and they have a heart problem or they have hypertension or they have diabetes, whatever kind of health condition they have, there's always a diet for every chronic conditions. If the person has kidney issues, there is renal diet. If the person has diabetes, there is diabetic diet. If the person have a heart problem, there is heart cardiac diet. So all of this diet, we always have those diet for people who have these chronic conditions, and that's just to help us manage the condition properly and make sure that we're changing the lifestyle, we're changing our diet. Eat a heart healthy diet. Include more fruits, more vegetables, whole grains, and lean proteins. Include what? More fruits, more vegetables, whole grain, and lean protein in your food. Okay, manage your stress. Number five, manage your stress. That is number five. We want to make sure that we're managing our stress. Okay, you can look for relaxation techniques like meditation, yoga, spa day, just music, anything that doesn't take too much out of you. Start with music, start with taking walks, reduce the stress, think about something else. Manage your stress because stress would increase your blood pressure. Avoid smoking and limit your alcohol. Number six is avoid smoking and limit your alcohol. If you keep smoking and you keep taking so much alcohol, all right, it will increase your blood pressure. And in some cases, doctor may also prescribe medications to help control the blood pressure. Okay. If all of these have been done and your blood pressure is still high, your doctor will prescribe medications to you that will help to lower your blood pressure. It's important that you take the medication. Like I always say, take the medication as prescribed. When it is prescribed, follow the dose, follow the frequency of your medication, and do not stop taking your meds because you checked it on Tuesday, it was 120 over 80. But then what happens by the end of the week when you've eaten all the different types of food that you eat without managing, what you eat? Your blood pressure can skyrocket to the 200s. So again, we don't want that. We want to avoid it, and we don't want to end up with stroke, because guess what? Hypertension and stroke they go together. Hypertension is the number one cause of stroke. So if you're not controlling your blood pressure, you can end up with stroke, and we don't want that. Remember that hypertension develops silently. It can develop over the years and you wouldn't notice any symptom until it becomes really worse. Okay, it's if left untreated, it can lead to a lot of damages, right? It can damage all of our organs. Okay, it can lead to stroke. So you want to make sure that you're on top of it. You want the best ways to protect your health is by checking your blood pressure regularly, maintaining a healthy lifestyle, and seeking medical advice where it's needed. Taking small steps today can protect your health and overall health. You can help you avoid chronic health conditions in the future. And one habit I want us to start this week: make sure that if you feel any of the seven signs that I talked about, you want to make sure that you have a home blood pressure monitor. When you're checking your blood pressure, you want to make sure you're relaxed, you're seated in a very comfortable position, your arms, and then you use the same arm all the time, same time, and in a seated position. Okay, calmly check your blood pressure. Now, if it's above 130, if it's 130 and above, 130 over 80 and above, you want to make sure you see your doctor. Okay, that way they can monitor it, and if they need to put you on medications, they should put you on medications. If you need to change your lifestyle to be healthier and more physically active, then you need to do that. Do not stop taking your meds. Okay, another one is, do not stop taking your meds because your blood pressure reading is within the normal limits. So even if you check today and it's good, keep taking your medication. You keep checking your blood pressure, and you feel like it's good over time, see your doctor, and then you and your doctor can decide on what you want to do next. If you notice any of the seven signs that I talked about, especially number three, okay, do not miss that. See your provider, see your doctor, and discuss with them. If you found this video helpful, like, subscribe, click the button below to subscribe, turn on your notification, and share this video to help create awareness about high blood pressure and your heart health. Okay, now let me know in the comments, when was the last time you checked your blood pressure? We've come to the end of series 3, high blood pressure, the silent killer. Thank you for watching, and I'll see you in my next video. Bye.